drugs acting on the urogenital system. As for the objectives, briefly describe the anatomy of urogenital system, discuss what is glomerular filtration, tubular reabsorption, and also tubular secretion. Lastly, present the different class of drugs and describe the indications for each type of drug. As for the coverage, we have the diuretics and other drugs, specifically the ecbolics and tocolytics. First on the line, it's diuretics. So we're going to tackle its functions, classifications, mechanisms, therapeutic use, and its adverse effects. Diuretic drugs increase urine volume by reducing sodium reabsorbing processes. These are compounds that increase the amount of urine and electrolytes expelled over time. Most diuretics increases urine volume by decreasing the effectiveness of sodium resorption processes, hence increasing mandatory water loss. This compound is used to increase fluid retention and edema, induce urine flow and renal failure, and reduce blood pressure. It merely provides symptomatic relief and addressing the underlying cause of the edema. For example, is the pulmonary edema. The MOA, or the mode of action of diuretics. At specific places in the nephron, all diuretics operate directly on the renal tubular epithelia. Understanding the effects of diuretics requires a brief review of ion and water transport in nephron segments. Since nephron is mentioned, these are the nephron function. First, the ultrafiltration. At the Bowman's capsule, blood is filtered out of the glomerulus to form filtrate. Selective reabsorption. In convoluted tubules, both the proximal and the distal part, usable materials are reabsorbed. The last function, we have the osmoregulation. The Henle loop creates a salt gradient which pushes water out of the collecting duct. We have three classifications of diuretics. We have the high efficacy diuretics, the medium efficacy diuretics, and lastly, weak or adjunctive diuretics. High efficacy diuretics, or the loop diuretics, is a group of drugs that includes some of the most potent and often prescribed diuretics, and they all have a common mechanism of action, wherein it restricts the reabsorption of around 25% of the filtered sodium load by blocking a critical sodium transport pathway in the thick ascending limb of the loop of Henle. Nephron segments distal to the thick ascending limb are unable to resorb the extra solute, resulting in significant natriuresis and diuresis. The most widely used diuretic in veterinary medicine is furosemide, or the Lasix, and there are also other drugs in this class, and that includes the etaclinic acid, bumetanide, and more recently the torsemide. The indications are edema of cardiac, hepatic, or renal region. Then again, furosemide, or the Lasix, is the most commonly used loop diuretic in veterinary medicine. Its indications are hypercalcemia, or too much calcium in blood, and hypercalciuric, or the excess calcium in the urine, nephropathy in dogs and cats. The furosemide drug interaction. In severe oliguria and acute renal failure coupled with osmotic diuretics such as mannitol to sustain urine flow and prevention of exercise-induced pulmonary hemorrhage, or EIPH, and epistaxis, or the nosebleed in race horses. For further information, furosemide inhibits the NAK calcium port in the thick ascending limb of loop of Henle. Its adverse effects are hyponatremia, ototoxicity in cats, or the deafness, and hyperglycemic effects, or the diabetes insipidus. The dose of furosemide can be seen on the screen. It can be via intravenous, intramuscular, and subcutaneous in dogs, and intravenous, intramuscular, subcutaneous, oral in cats. The most prevalent side effects are fluid and electrolyte abnormalities, particularly the hypokalemia, dehydration, muscle weakness, CNS depression, volume depletion, and cardiovascular collapse may result from high or extended doses. Note that cats are more vulnerable to effects of loop diuretics than in dogs. Loop diuretics may change electrolyte balance in the inner ear and the lymph, and there may be transient granulocytopenia and thrombocytopenia. The next classification is the thiazide and related diuretics. Under the benothiazides are the chlorothiazide, hydrochlorothiazide, benzthiazide, hydroflumethiazide, and clopamide. Meanwhile, in related heterocyclics are chlorthalidone, metolazone, cipamide, and indapamide. Its primary site is cortical diluting segment. The thiazides are weak inhibitors of calcium, but at normal doses, this does not contribute to their diuretic action. Paradoxically, thiazides reduce urine output in diabetes insipidus. It inhibits the conversion of proinsulin to insulin, thus may induce hyperglycemia and glycosuria in diabetic or prediabetic states. Its therapeutic use. The chlorothiazide and hydrochlorothiazide are beneficial as adjuncts to cardiac medications in the treatment of congestive heart failure in dogs and cats. Other edema in cattle is treated with hydrochlorothiazide and trichlormethiazide. Thiazide diuretics reduce urine production in dogs with nephrogenic diabetes insipidus. Hydrochlorothiazide is used to treat calcium oxalate urolytes in dogs by reducing urine calcium ion excretion. Its adverse effects are hyperglycemia, hyperkalemia, and hyponatremia. The moderate diuresis produced by thiazide results in less disturbance of ECF electrolyte balance than other classes of diuretics. Hypokalemia and hypochloremia may develop with high or prolonged doses. Hyperglycemia may occur and may aggravate pre-existing diabetes mellitus. The last classification of diuretics is the weak or adjunctive diuretics. The acetylazamide are inhibitors of carbonic anhydrase. The spironolactone are aldosterone antagonists. Potassium-sparing diuretics are inhibitors of renal epithelial sodium ion channel. Moreover, triamterene and amiloride. The osmotic diuretics, the mannitol, isosorbide, and glycerol. Lastly, the xanthine, specifically the theophylline. The carbonic anhydrase, drugs that are reversible inhibitors of carbonic anhydrase. Management of glaucoma. It also catalyzes certain reaction. The aldosterone antagonists, the spironolactone, drugs that act by diminishing the sodium ion active resorption system. It is vital to sodium conservation even with the last few percent of filtered sodium is controlled. The spironolactone is the most potent antagonist. It is also a steroid lactone which acts by competing with aldosterone. Its use is hepatic cirrhosis.
Carbonic hydrase inhibitors. Mechanism of action of these agents is it reversibly inhibit calcium enzyme predominantly in the proximal convoluted tubules, causing a reduction in hydrogen ions available for sodium and hydrogen exchange. Therapeutic uses. The primary use of calcium inhibitors is for reducing the rate of aqueous humor formation in the treatment of glaucoma. They are occasionally used as adjuncts in the treatment of metabolic alkalosis. Also, their diuretic action is weak and they are seldom used for this purpose now. The adverse effects of carbonic hydrase inhibitors are the following. Toxicity is rare, but fluid and electrolyte balance and urine output should be monitored, especially in the treatment of oliguric renal failure. Lastly, mannitol have small soluretic effect, and because it produces an initial expansion of the ECF, which may decompensation in patients with congestive heart failure. The following are the osmotic diuretics. First is the mannitol, followed by the isosorbide and the glycerol. They are pharmacologically inert substances, filtered through the glomerulus, not absorbed in the tubules. The mannitol causes primarily a water diuresis. It is given intravenous as 5 to 10% solution at 1 to 2 mg per kilogram. They are mainly used in acute renal failure to maintain GFR. They can also be used in shock, severe trauma, cardiovascular surgery, and hemolytic reactions. In addition, they are also used in forced diuresis or poisoning and reduction of intracranial pressure. Next is the xanthine theophylline. It produces a mild transient diuresis with its mechanisms, increase in renal blood flow and GFR, direct inhibition of tubular reabsorption, and it is not used as primary diuretic. Ecbolic or oxytocics. An ecbolic is an agent which stimulates contraction in the uterus at term, especially in the treatment of atonic and hypotonic parturient uterus. Certain drugs have the ability to induce parturition before full term and are known as abortifacients. Their action is to increase the contractile activity of the uterine muscle. The use of ecbolics is indicated in the following. During parturition, the fetal position and the presentation are normal and the cervix adequately dilated by the process of parturition if prolonged. It is also used for a flaccid postparturient uterus which is not contracting or involuting and for postparturient hemorrhage. The different ecbolics that have therapeutic importance includes oxytocin, ergot alkaloids, and prostaglandins. Oxytocin is a nonapeptide hypothalamic hormone stored and released from the posterior pituitary. Oxytocin is released by fetal and urine stimuli at the same time of parturition, vaginal stimulus during coitus, and teat stimulus following suckling by the young one. The oxytocin's actions are it increases uterine contractions and milk ejection and facilitates transport of sperm in the female genital tract. The therapeutic uses of oxytocin are it is used to induce labor and reverse uterine inertia, but it poorly works when the CL exists. It is used to treat agalactia through stimulation of milk ejection. However, oxytocin is not a galactopoietic agent. Its adverse effects is to cause uterine dystocia. Ergonovin is an ergot alkaloid that causes prolonged contractions of smooth muscle, including the myometrium and blood vessels. Mechanism of action. Its effect on smooth muscle is mainly through activation of alpha-adrenergic receptors and possibly also through modulation of serotonergic and dopaminergic receptors. The therapeutic uses of ergot alkaloids are the following: induction of uterine involution, postpartum hemorrhage control, and expulsion of placenta, particularly in cows and bitches, when oxytocin is ineffective. Route of administration. It is administered orally to dogs or intramuscular to mares, and the duration of action is 2 to 4 hours. Adverse effects of ergot alkaloids. Safe when given as directed, however overdose may cause CNS excitation, muscle weakness, hypertension, and vomiting in dogs. It may cause agalactia through inhibition of prolactin release. Prostaglandin F2 alpha or dinoprostratamine. These also have a role in physiological parturition. They help in termination of prolonged pregnancy. Pharmacologic effects are prostaglandin alpha and analogs cause strong vasoconstriction. Decreased blood supply causes autolysis and reduction of progesterone synthesis. Prostaglandin alpha and analogs have a strong oxytocic effect, especially in mares. The therapeutic uses of prostaglandin F2 alpha are the following: astrocycle controls in cows. Prostaglandin F2 alpha and analog induce luteolysis of mature corpora. Early abortion usually occurs within 7 days of injections as a result of luteolysis. Labor induction. Perform the induction 3 to 15 days before due. In cows and sows, 1 to 8 days after administration, or average is 3 days. Pyometra. Prostaglandin F2 alpha can be used to treat pyometra and facilitate the expulsion of mummified fetuses. Ovarian cyst, following treatment with GnRH to cause ovulation. Prostaglandin F2 alpha is administered to induce luteolysis. The adverse effects of prostaglandin F2 alpha are the following: placental retention, dystocia, and acute systemic toxicity. Example are salivation, vomiting, colic, defecation, fever, anxiety, tachycardia, and tachypnea. Tachypnea includes sweating and transient decreased rectal temperature, which are seen in mares. Tocolytics is also known as spasmolytics or uterine relaxants. It relaxes or inhibits the smooth muscle of gravid uterus. Mode of action: it inhibits both of the spontaneous and oxytocin-induced contractions of pregnant uterus. Clinical applications: prevention of premature labor or to delay parturition for managemental convenience. Isaxaprine is a tachylytic drug which is administered at dose rate of 0.5 mg per kilogram in all the species. The effect is seen within 15 minutes of injection and it lasts for 2 hours. Side effects may include tachycardia, peripheral vasodilation, and muscular tremors.